Thyroid nuclear scans play a very important role in evaluating a number of thyroid disorders. Thyroid gland essentially is a iodine concentrator. It takes up the iodine in the gland and converts it into the thyroid hormones T3 and T4. Nuclear scans are based upon the principle that if we inject a dye which has got a very small minuscule amount, quote unquote trace amount of a radioactive compound which is taken up by the thyroid gland, it will get concentrated there, and the emission of these radioactivity will be read by the detectors, and we can identify whether the thyroid gland is there or not, whether it's working more or not, whether the whole gland is working more or a part of thyroid gland works more. Thyroid scan is a very safe and simple procedure. It takes around half an hour to 1 hour, and it can be done even for a small neonate. The only precaution to remember is that we should not do it when we have started treatment, because that treatment can affect the uptake of the thyroid scan. The most important use of thyroid scan in children is in the setting of congenital hypothyroidism to decide whether the gland is formed or not. In neonates, we've got very low level of thyroid, that is congenital hypothyroidism. If the scan shows that there is no uptake, it would indicate that there is a problem in terms of gland development. And if the ultrasound also confirms the same, this means that this is what is known as a thyroid agenesis, and there is a need for lifelong treatment. If the thyroid scan shows that the gland is not there in the normal position, it is somewhere above, which is an ectopic thyroid, this would again indicate that there is a need for lifelong treatment. Some individuals may have a normal or increased uptake despite deficiency of thyroid, and in this scenario this may be because of what is known as decreased production of thyroid, that is dyshormonogenesis, or this may be a transient phenomena which may improve over time. Thyroid scan helps us in differentiating thyroiditis, which is the release of thyroid hormone, from thyrotoxicosis or Graves' disease, which is increased production of thyroid hormone in the setting of somebody who has got high levels of thyroid. So if an individual who has got high thyroid levels has got increased uptake in the thyroid gland, this is indicative of increased production and the need of anti-thyroid drugs. While if there is a decreased uptake, this is suggestive of a possibility that there is a reduced uptake and there is a damage to the thyroid gland. We do not need to give anti-thyroid drugs.